Hi, today we're going to begin um, the second part of the skeletal system. I've kind of broken the skeletal system up into four different sections. So we're starting 4.2 today, which focuses in on the axial skeleton and the bones of the axial skeleton. So in the first part of the axial skeleton, we're going to focus in on the bones that make up the skull, including the facial bones. Just to recap real quick, the difference between the appendicular and axial skeleton. So we're focusing on the axial skeleton during this module, which is everything that is blue in this diagram. So the bones that make up our axis. So the skull, the vertebrae, thoracic cage. Of the 206 bones in the body, 80 of them, or about 40% of the body, is axial skeleton. So for part one of this lecture, we're going to focus in on just the bones that are part of the skull. So the axial skeleton as a whole has some important functions, and some we've already kind of talked about when we talked about the functions of the skeletal system in general. The first one is protection. And so if you look at the bones that make up the axial skeleton, their job is to protect our most vital organs. Our brain, our spinal cord, our heart, our lungs are all protected by bones of the axial skeleton. And then the second big function is their role in muscle attachment. So our bones have surfaces on them that play an important role in muscle attachment. A lot of the muscles of the head and neck and trunk attach to the axial skeleton. We also have muscles that are responsible for breathing that attach to the axial skeleton, and also muscles that stabilize the bones of the appendicular skeleton. All have attachment points on places in our axial skeleton. So we're going to start off looking at how the bones of the skull are organized. If we take a look at the skull contains 22 bones that you will need to learn to recognize. So between using the PAL software and the models and bones in the lab classroom, you should practice with recognizing these bones and some of their major structures. The skeleton is broken up into two kind of sets of bones. The first set are bones that make up the cranium. Cranial bones include 8 bones. Their job is mainly to protect the brain. They also are sites of a muscle attachment for muscles that move the eye and the mouth and the head. On the inner surface of the cranium, so if we were to slice open the cranium and look inside here, and some of the skulls that we'll see in the classroom, you can take the top part, the skull cap off, and you'll be able to see on the inside better. But on the inner surface of the skull, you'll see sites of attachment for blood vessels and nerves and membranes also. Now, the other set of bones that make up the skull are called the facial bones. Now, the facial bones are where the muscles that are responsible for facial expression attach. Also, the muscles that are responsible for mastication, which is just a fancy fun word for chewing. There are also some deeper facial bones that separate our nasal cavity from our oral cavity. So our cranium and our facial bones. Now, there's kind of like a third, I'm going to put them other category, other bones that are related to the skull. One of them we will look at during the second lecture when we get to the rest of the axial skeleton. We have the hyoid bone that kind of sits up here, which is another bone that's kind of, I guess you can include it with the skull, or you can include it with the vertebrae and the thoracic cavity. And then the bones of the ear. So inside the temporal bone, we have the ossicles of the ear, and we'll look more at those when we get to the anatomy of the special senses, including the ear. So we're going to start out looking at the cranial bones. So the bones that make up the cranium. 3 of them, the frontal bone, the occipital bone, and the parietal bones collectively are sometimes referred to as the bones of the skull cap too. So we have the frontal bone, which is located up front here in yellow. The occipital bone, which is at the back of the head in brown here. The parietals, we can see one of them. So there's a pair, one on the right side and one on the left side. We also have the temporals, which are a pair. So we're seeing the right temporal here. And then we have the sphenoid, which we can see kind of goes from one side of the skull behind the eyes all the way across. And so we can see part of it here in pink. And then the other cranial bone that we can just see is the ethmoid. And you can just see the ethmoid bone kind of peeking out right here. It's kind of like a dark orange or a brown, a burnt sienna maybe color. So those are the bones that are considered to be cranial bones. So the first one we'll take a look at here is the frontal bone. The frontal bone makes up the anterior part of the cranium. It also makes up the roof of the orbit of the eye. So you can see the eyes would be right in here. There's kind of this bump at the front of the forehead here, kind of between the eyes, called the glabella. The top part here, above the eye, this is the supra above, orbital, above the orbits of the eye margin. It's kind of a thickening of bone that is kind of across the top of the eyes here. You can also see on this skull what remains, this is the frontal suture. This is actually not fused when you're born and fuses somewhere in childhood. So you can see the remnants of that suture there. If we take the skull and we flip it, so we are looking up at it, so this would be where the eyes would sit in, right? This is the nose up here, or where the nasal bones would fit in. We can see a little different view here. There's little holes in here. Can barely see them. The supraorbital foramens, they are passageways for blood vessels. There's also kind of a little bit of a fossa or a dip in here on each side that you can see. That's where the lacrimal glands or the tear glands kind of sit in above the eye there. So that's our frontal bone. Our next bone in the back of the head is the occipital bone. It forms a joint with our first vertebrae, with the C1. And you can see here on each side where that joint is made. So those areas there are called the occipital condyles. And those occipital condyles sit on top of the atlas, or the C1, to make the joint between the skull and the vertebrae. There's also a large hole here. This large hole is a foramen. And so foramen is a large hole, and this is the big one, so it's foramen magnum. So that is the hole that the spinal cord would exit the brain through. Other important parts, kind of at the back of the head, if you feel kind of at the back of the head, you can feel kind of a bump back there. That bump kind of in here, that's called the external occipital protuberance. And it's a big bump kind of at the back of the head there. There's also kind of a little crest or a line that you see here that is a muscle attachment for ligaments. And that's kind of it for the occipital bone. The next bone that we're going to see here is called the ethmoid bone, and the ethmoid bone kind of sits, if you can imagine the skull kind of like a bowling ball, and if you were to reach your fingers into the nasal cavity and the eye sockets and you were to grab the bone that's kind of behind there, that's the ethmoid bone. So it looks kind of strange when it's yanked out and you see the whole structure of it, but it forms the medial and the anterior floor of the cranium. It is the roof of our nasal cavity. It also forms part of our nasal septum. And it has a lot of holes in it. It's kind of, it's one of the locations of our sinuses. So you can see all kinds of holes or air spaces in here. Those are called the ethmoid air cells, the ethmoid sinuses. This view that you're seeing here is of the superior surface of the ethmoid. And the view you're seeing over here is the posterior surface. A couple of important structures. In the center here is a structure called the cribriform plate. At the bottom here, sticking down, you can see on both views here, is what's called the perpendicular plate. We also see some nasal conchae. So in this area, so these are kind of flaps of bone that are covered with a skin inside the nasal cavity that help increase the surface area. So when air goes into the nasal cavity, it gets warmed up and moisturized and filtered. So those are the middle nasal conchae. And then above that, we have the superior nasal conchae. So real kind of thin flaps of bone in there. And at the very top here of this posterior view, you can see a structure that's called the coxcomb, like a rooster. It's called the crista galli, which translates into the coxcomb. So it's supposed to look kind of like the comb on the top of a rooster. Okay, so that's it for the ethmoid bone for now. Our next bone, this is, I guess, my favorite bone of the skull because it looks like a bat. It's called the sphenoid, or it's also referred to as the bat wings. And so if you look at it, it kind of looks like a bat, like the wings of the bat, if you use a little imagination. So you can see a couple different views here. So this would be like a superior view of it. So if we cut the skull cap off and looked down to the skull at the sphenoid, it stretches from one side of the skull all the way across to the other side. It has wings. It has the greater wings, which are kind of these big wings sticking out on each side. And then it has some lesser wings. You can kind of see the lesser wing right here and part of the other lesser wing here. Right in the center here, this is a structure called the sella turca. It's the, it means like Turkish saddle. This is actually where the pituitary gland sits. And we will see the pituitary gland a couple times in the nervous system and the endocrine system, but it's called the master gland. It sits right inside of there. This view at the bottom here is more of an anterior view. So if you're looking straight at a skull and you could kind of remove the other bones and see just the sphenoid. In the middle here, you can see a giant cavity. This is actually a sinus. So that's a sphenoid sinus. And we'll see some other views of it. So that's the sphenoid bone. It's kind of like the keystone or the cross base bone of the skull, since it also unites all of the cranial and facial bones together. The next bone are the parietals, and the parietals we have two. We have a right parietal and a left parietal. So here we're seeing the right parietal bone of the skull. And it forms the lateral and superior part of the cranium. If you look at the inner surface here, we're seeing the anterior, the outer surface of the bone. If you were looking on the inside of it, you would see some grooves on the underside for blood vessels. It's the site of muscle attachment for the temporalis muscle. And there's a couple of kind of structures, bumps. They're real hard to kind of see and align in here, where the site of attachment for that temporalis muscle. Our next bones are the temporal bones. And so the temporal bones, you also have two of these, one on the right and one on the left side. They form the lateral walls and also the zygomatic arch on the lateral sides of the skull. They form a joint with the mandible. They also contain the bones of the inner ear. They have muscle attachment sites for muscles that are important for moving the jaw and the neck. So what you're seeing here is a medial view. So if we were to do a sagittal section through the skull and you were to look at this bone from the inside, you would see, so over here, this is actually the zygomatic process from this view. You can also see a little structure kind of sticking out, or a hole here. This is actually the hole in there would be the canal that the ear canal runs through. So this is the internal acoustic meatus. And you're seeing that same, so in this other view here where you're seeing, so this is a lateral view of this bone. And so you're seeing the outside, that's the external acoustic meatus. This bone has kind of two parts. The actual ear ossicles would be in here. This is called the petrous portion. The part that is more flat is called the squamous portion, just like squamous cells are flat, so is this part of this bone. There's a big bump down here, and you can see it here and here. That's called the mastoid process. Right, mastication means chewing. Mastoid process, muscles of mastication attached there. We also have the styloid process. It's kind of styloid, stylus. You can see it in both views here. Another site of attachment. So lots of fun stuff going on with the temporal bones there. Our next, we're going to look at the sutures of the skull. So sutures are immovable joints, and they occur between different bones of the skull. So the first suture we have is the coronal suture. The corona means like crown or halo. So this suture kind of runs around between the frontal bone and the parietal bone, kind of from one side of the head all the way across to the other. Our next suture, the squamous suture. This suture is on that squamous or flat part of the temporal bone between it and the parietal bones. So this is coronal, this is squamous, and you can only see, there'll be another one on the other side of the head too. The lambdoid suture, you can see a little bit of it in this view, right here between the parietal and the occipital bone, but you can see the entire lambdoid suture back here. And you can see in this picture, actually, there's a couple of little bones there, right? In the lambdoid suture, some Wormian bones. So this is the lambdoid suture. And then the last suture is the sagittal suture. So just like a sagittal cut cuts the body into right and left half, the sagittal suture cuts the skull into a right and left half. So you can see the back part of it here in this view. It would be running across the top of the head in this picture. So you really can't see it from this view very well, but it would be there. Okay, so the next bones we're going to look at are the facial bones. There are 14 facial bones. that also make up the skull along with the bones of the cranium. So we have the maxilla, the maxillary bones, the zygomatics, the palatines, the nasals, the lacrimals, the inferior nasal conchae, which are separate bones, the mandible, and the vomer. So the first bone that we're going to look at here is the maxilla. And the maxilla, there's actually two of them, a right and a left half, and they fuse together. They're the largest of the facial bones. They form the upper jaw and the lower part of the eye orbit here, and most of the hard palate. So the roof of your mouth is the hard palate, and the anterior portion of it is maxillar bones. You can see over here where the zygomatic, this is the zygomatic process where it meets up with the zygomatic bones, the cheekbones. There's joints in here between the maxilla and the teeth of the upper jaw. They're called alveolar processes. There's also a large hole here called the infraorbital foramen. This is the passageway for nerves. The maxillary bones also contain sinuses, so they have the largest sinuses, and we'll look at those in a little bit because you can't really see them from this particular view. Our next set of bones is the zygomatics. The zygomatics are also called the cheekbones. We have two of them. We have one on each side. In this particular diagram, they're blue in this color diagram, right? So you can see them here. So we have one on each side. So they also form part of the orbit of the eye. So the lateral orbit of the eye is making up the zygomatics. There is a little hole there. That's actually a passageway for a nerve, the zygomatic facial foramen. Those are the zygomatics. The next bones are the palatines. The palatines are super interesting to me because you can't really see their shape unless you strip away some other bones. So you can see just the surface of the palatines, the inferior, the floor of the orbit of the eye, but then they kind of come down like this and they go back and they form the roof of the mouth. So this part here, oops, not what I wanted to do. This part here, you can imagine this is the eye, right? And then this is at the top of the mouth. So this would be the oral cavity. So if you reach back with your tongue, you can feel the first part of the hard part of your mouth is your maxillary bones, but then towards the back part of the hard palate is actually the palatines. And they're actually two bones, they fuse together. So someone who has a cleft palate, for example, the bones of the maxillary bones may not fuse together, and these palatine bones may not fuse together properly. The part that sticks up here is called the perpendicular plate, whereas the part that forms the back part of the roof of the mouth is called the horizontal plate. Okay, our next bones, we actually have two of them on here. We have the nasals, and also in this picture we can see the vomer. The nasal bones are at the bridge of the nose up here. It's two bones, and you can see a little separation between them there, and they connect to cartilage. The vomer sticks up at the bottom here, so it kind of reminds me sometimes of like a shark fin sticking up in the middle. If you look at a skull's nose from the bottom, it's the inferior part of the bony septum, the nasal septum that separates right and left half. Our next bones are the lacrimals, and the lacrimals in this picture are this little red bone here. So you see kind of right on the edge here. The lacrimals have a canal, the nasolacrimal canal that goes through them. So this is when tears drain out of the eye orbit, they drain through that nasal bone. That canal continues through the maxillary bones, and then that fluid will end up in the nasal cavity. There's also kind of a depression in this bone that allows, there's a structure called the lacrimal sac, and the depression in there, that lacrimal sulcus, is where that sac sits. Our next bones are the inferior nasal conchae. So The other nasal conchae were part of the ethmoid bone, but the inferior ones are their own separate bones. So you can see one on each side if you look into the nasal cavity. They help also increase surface area like the other nasal conchae. So when air goes in, it gets exposed more to be cleaned and proper humidity and warmed before that air goes down into the lungs. And then our last of the facial bones is the mandible. So the mandible forms an important joint we'll look at a little bit later, right? The temporal mandibular joint. But if you look, so this view up here, this is the mandible on the surface. This view down here is actually a medial view. So if you can imagine slicing through the mandible, so you're seeing half of it, right? And you're seeing it from the medial view, so kind of the inside. So if you were to reach your finger in, that's what you're seeing inside there. So it's also called the lower jawbone. Out here you can see this hole back here, that's the mandibular foramen, so blood vessels and nerves run through there. You can see kind of a depression here. That's actually where one of our salivary glands sits. This other view of the mandible, we can see a couple of important structures. So this back bump here is called the condylar process. And this is the articulation surface for that temporal mandibular joint, TMJ. You also have the second kind of more pointier thing here, another process that's called the coronoid process. And that's a site of attachment for the temporalis muscle on the side of the head. This is the ramus of the mandible. This is the angle of the mandible. Mental protuberance or mental region, the chin. We see a hole up here, so we know something probably passes through it, like some nerves. That's the mental foramen. Okay, the last thing that we're going to look at are the fetal skull and then the sinuses real quick. The fetal skull, as you can see, is a little bit creepy looking. It forms, remember, via that intramembranous ossification. As far as the two different ways the bones form, that's how the bones of the skull are going to form. It has many centers of ossification, so ossification starts all over the skull and kind of spreads out. The fetal skull is very large in size for the body of a fetus. It contains what we call soft spots or fontanelles. Those fontanelles allow for our skull to continue to grow, allow it to be flexible so it can come out of the birth canal. So if we take a look at those fontanelles, we have four major ones. The anterior fontanelle is at the surface of the head, so you can see it from two different views. This is a superior view and a lateral view, but that's the anterior fontanelle. The posterior fontanelle is going to be at the back of the head, so you can see it here and here. The anterior fontanelle is the largest and it stays open the longest. The posterior, the sphenoid, and the mastoid fontanelles all close up within the first couple of months after birth. But the anterior one continues to stay open to about the age of 2. Most of the skull growth happens in a child before the age of 5. The sphenoid fontanelle is right here above the sphenoid bone, and then the mastoid fontanelle is back here at behind that mastoid process, that bump. So you can see the mastoid fontanelle sits back there behind the temporal bone. And then the last thing we're going to look at is the sinuses. So we have sinuses that help lessen the weight of the skull, lighten up the skull. They're air-filled chambers with a mucous membrane that lines them. We generally don't really think much about them until they get infected, right? They have a role also in speech. But we have 4 areas where they're located, or 4 different bones. So we have one set of sinuses up here in the frontal bone. We have another set of sinuses in the maxillary bones. We have another set of sinuses in the ethmoid bones. They're kind of the green, those are the ethmoid aerosacs. And we have a set of sinuses in the sphenoid bone. And the next slide kind of shows a different view of some of those sinuses. So if you were to slice through the maxilla, for example, here you can see those maxillary sinuses, this opening a little better. Down here, if we do a section through the frontal bone, you can see those frontal sinuses. The frontal sinuses actually don't develop in all people. The maxillary sinuses are pretty large. The frontal sinuses don't typically develop till later, sometime after the age of 6, and they're not always present. So if you have a chance to look at a skull where it's had the skull cut off, you can look and see sometimes it'll slice through a frontal sinus and you can see the opening. The sphenoid sinus, you can see right here in the sphenoid bone, that big opening. Just another view of it. In neither of these pictures can you really see any of the ethmoid sinuses, that collection of those smaller cells. So that's it for the first part of the axial skeleton. So in the next mini lecture, we will take a look at the bones that make up the rest of the axial skeleton. So the vertebrae, the thoracic cage, and the hyoid bone.